Good evening, friends. This is Dr. Chetna Jain. I'm Director and Senior Consultant at the newly opened Cloud9 Hospital in Sector 14. This is the Department of Energy. And today we are going to talk about polycystic ovaries and infertility or subfertility. Now, polycystic ovaries is a very, very common phenomena. By definition, it is present in about 20-25% of all women, but some of the other feature might be seen in even up to 50% of all women. And what I see is it is so hyped that each one of you, when you read that you have polycystic ovaries or you figure out that you have polycystic, you freak out, you get worried, you're afraid that there's something very serious and you start running to the doctors. So first I want to explain what's a polycystic ovaries. So polycystic ovaries is different than ovarian cyst. These are in polycystic ovaries. Essentially, it is a hormonal disturbance. It is a metabolic disorder, but it is not as ovarian cyst. It is seen as small cyst in the ovaries, which is scattered all over. But these cysts do not need removal. The treatment of these cysts is not removal of the cyst, but it's the other methods that we're going to talk. So, for polycystic ovaries, first you have to diagnose that why it is seen and how it happens. So, polycystic ovaries is essentially considered a genetic disease. That means it runs in the family. Now, women would say that, it was not seen in any of my family member, mother, grandmother, nobody ever had polycystic. Yes, they never manifested, though probably they carried the genes because of their body weight. So earlier women used to weigh all below 50 kilos, and these disease they manifest once you cross the normal standard BMI. So it starts manifesting when your BMI is more than 23, or it may manifest anytime later. It depends on how your body is. So, for Indian women, a BMI of 19 to 23 is the best. So, if you have greater BMI, you must control it so that the polycystic ovaries do not cause any problems. Now, how to know that you have polycystic? So, it can lead to facial hair growth, weight gain, black discoloration of skin in the neck, underarms, in the private parts, irregular periods, very scanty periods, difficulty in getting pregnant, hair fall from the head. So, all these are features of polycystic. How it impacts fertility. So, in polycystic ovaries, what happens is the egg formation is not good. That means every month, either the ovulation is not regular or it is absent altogether. But it is not something to be fearful about because it is easily treatable. So, but why it happens? As you gain weight, because of the deposit of body fat, the body hormones changes, and from female hormone it changes to male hormones. So these male hormones they suppress the ovaries in such a way that the egg maturity which should happen doesn't happen, and each month the woman releases one egg doesn't happen, and there's no, so that means there's no ovulation. Once there's no ovulation, there's no conception. So it is important for conception for conception, ovulation is extremely important. So once we bring down the body fat, the body, the female type of hormone will stay, and the male type of hormone will not be there, and the ovulation starts. So that is why, as soon as we see the patients with polycystic ovaries, we suggest that you start losing weight. Now, most of the people will believe that as soon as you go to a doctor, the first thing doctor talks is about losing weight. Now the thing is, there are other medications also, but there is no substitute to weight loss, and at the end of the day, weight loss will lead to control of not just body weight but other problems associated with polycystic ovaries. So, polycystic ovaries, other than fertility and cosmetic issues like weight gain and facial hair and black discoloration, hair fall, etc., it also causes other problems like high cholesterol, breast cancer chances reduce, though there are certain other benefits also, that the chances of ovarian cancer are reduced, but there are other problems with uterine cancer. So it is very important to control it, and the control is best done through natural methods. And what better than control of diet and weight? So, weight control is the most important thing in management of polycystic ovaries. Weight can be managed through diet and through exercise. The most important thing is low carbohydrate diet, small frequent meals, eat on time, sleep on time. A lot of us, we binge on sugary drinks, cold drinks, even a lot of alcoholic drinks have a lot of sugars in that, and that leads to extreme weight gain. Then, to control weight, a lot of women, what they do is they stop drinking those, but they start consuming. So they do not eat their food and they will just have a glass of wine. That's again not a good thing, because that will not give all the nutrients to the body. So you have to lose weight in a very healthy way, wherein you consume small quantity. You do a very gradual diet control, and you control. I'm not suggesting that you will never take all these things, which are good and which are very pleasant to tongue, the palatable part of your diet. You must consume once in a while, but you must try to lose weight in a way that you maintain it later on. It's not that you do a crash diet, you lose a lot of weight, some 20 kilos, and it comes back in 6 months' time. So, not the right thing to do. So we were talking about, so simple carbohydrates will not lead to weight loss. You must use a lot of complex carbohydrates in your diet and a high protein diet. So that can lead to weight loss. How you can improve fertility? One is certainly by losing weight. Secondly, by increasing the exercise, the physical activity. Once you increase the physical activity, the the hormones, they change. Even if you don't lose weight, there's a change in the pattern. The fat is lost and the protein is gained in the body, and that also leads to change of the hormone. And a lot of women, just by exercising and weight loss, will start having regular periods. The acne will go away and they will conceive. So it is highly recommended that you do diet and exercise for weight loss in polycystic ovaries to conceive. So it's not that if you lose weight, you will definitely be able to conceive with weight alone. Yes, it helps, but not just weight alone. You will need other things also. So, what are the other things? So, first, so we'll do the certain hormonal assessment to know what kind of hormonal disturbance you have. So, in polycystic ovaries, typically the LH is raised, free testosterone or testosterone might be raised, and there are other male type of hormones which could be raised. And so once we know that this is polycystic ovaries, so the suppressive treatment could be given, like the insulin resistance is high, so that can be suppressed by taking medicines. Now, after doing weight loss, insulin sensitizers, all these medicines, once you take and still you do not start ovulating, then you can be given drugs to induce ovulation, but that's the last step. But this is what you want as first step, that you do not want to try the hard way. You do not want to lose weight, do not want to control diet, and you just want to take medications to conceive and have a baby. But if you conceive with polycystic ovaries, the chances of various complications in pregnancy are high. What they could be: one is certainly excessive weight gain. Other is diabetes is commonly seen in people who conceive, who are polycystic and who get pregnant and they do not control their weight. They get gestational diabetes, and if they do not control it well, it can actually turn into a frank diabetes even after. So that means this diabetes might persist even after the childbirth. And women with PCO have higher chances of developing hypertension in the pregnancy. So it is extremely important to control and optimize your body weight by doing this before you conceive. So we were talking about how we make the polycystic woman fertile. So these are the points that we were talking throughout. So now I will again repeat. So one is that you start by dieting, by taking low carbohydrate, taking simple complex carbohydrates, dropping simple carbohydrates, and taking protein diet, taking small frequent meals, sleeping on time, eating right, eating on time. This will control your diet. So you should have a proper meal of fruits, vegetables, salads, dal, protein in terms of dairies. If you consume eggs, then try to take only whites. When you're taking meat, you can take only lean meat and do not take the red meat or the fleshy. The fleshy is okay, but not the fatty meat. So like suppose you're eating chicken, you try to remove the skin and the fat below and take the chest. So similarly, you can find what is a low calorie protein meat, and you can consume that. So if you have low fat proteins, so interestingly, it is a low fat protein that will lead to weight loss, because other proteins, if you eat in larger quantities, you might actually put on a lot of weight. So we were talking about weight loss. Then comes exercises. Now, what kind of exercise? So minimum 30 minutes every day. And the pulse rate should, if your heart is good and you're healthy and young, then your pulse rate should go up to 130. And this has to be maintained for a minimum of 30 minutes, at least 5 days a week, to achieve a modest physical activity. And you've been already doing this much, and if you can increase it further, you do that. Do not believe that doing physical activity will interfere with conception. It will rather improve by improving your body structure and also eliminating the toxins from your body, which will purify the body and make the body harvest a better seed. So please do exercise very regularly. After that, if you think still you're not ovulating regularly, then you need the help of the practitioners. So here you will be put on insulin sensitizers, one, and there are some. So there are two, three kinds of insulin sensitizers which can be used alone or in combinations. With weight loss, they work well, and a lot of women will start ovulating on these, and they conceive. And in spite of that, still, if there's no ovulation, if still resistance, then we start giving you ovulation induction agents. So there are various kinds. It can be oral or injectable. So we start with oral, and is given first in the first few days of menstruating period, and then by doing ultrasound we monitor. If you grow well, you make good eggs with that, it's fine. Otherwise, in a subsequent cycle, we increase your dose so that you start ovulating better. If the oral medications do not work, which happens very rarely, it can happen in about 20-30%, that the polycystic ovaries are that strong that with oral medication, the egg formation is not there. In this scenario, we can use injectable medications. So, injectable medications are used a little later, and they are expensive. They are also started on second or third day of periods. The monitoring is done very closely. In polycystic ovaries, sometimes the problem with injectables are either no egg formation or suddenly there's a blast of eggs and too many eggs are formed in the ovaries. They swell so much that they can actually touch the diaphragm and fill the whole abdomen. It's a very painful and risky situation, risky for the woman's life. And all the practitioners, they try to avoid this. And this is known as ovarian hyperstimulation syndrome. So we all try and avoid ovarian hyperstimulation syndrome by giving very tiny doses. But typically, if you have exercised well, you have controlled your diet, you have taken insulin sensitizers, and you have been on gradual rise of medication, there's a small chance that you will suffer that. These regimes, injectables, are more often used in IVF cycles. So, most of the polycystic women will not need IVF because they will conceive once they take all these major measures and or the egg formation starts. So whenever we see polycystic and we tell the patient that, look, you have polycystic, and because of that you haven't made an egg, they feel very depressed and they feel, oh my god, this is, oh my god, I don't have an some of them are not even married, and if they see that they have polycystic, they come running that, how will I get pregnant, I have polycystic. So there's a lot of negativity and a lot of myth about it. Yes, polycystic ovaries needs to be taken care of. You can't sit on that, you should never ignore it, but that doesn't mean that you should panic about it. So pay attention to polycystic from a very young age. As soon as you start noticing that your weight is going out of proportion or developing any signs, I repeat once again, we start from the top, the hair fall, then you come to the face, the facial hair growth, you come to the neck, the dark discoloration in the neck, behind the neck, especially in the underarms, below the breast, between the legs. Then you come to the uterus, so scanty periods, delayed periods, difficulty in conceiving. Then come to the blood, so high levels of cholesterol, high levels of HbA1c, which you all understand, or blood sugars. So all these are kind indicative of these are symptoms of polycystic ovaries, and all these can be verified by doing two things: an ultrasound and a blood test. The blood test is best on a second or third day of period. A lot of people fail to understand that, and they do test on any day of the period. They look at a prescription of a friend and they try to replicate doing it. So please don't do that. And if you do it, you do it at the right time. So day 2 or day 3 of the periods, the tests are done and then they are read properly. So that will be very indicative of if somebody is having polycystic or no. And one patient with polycystic will have one kind of symptoms, other patient with polycystic will have other kind of symptoms. Not all polycystic are fat. Some of them are actually thin. So we have lean polycystic also, and a fat polycystic. So lean polycystic have their own issues and fat polycystic have their own issues. Altogether, they are polycystic. Then we have an ultrasound criteria. So these ovaries are slightly enlarged and they show tiny cysts around the periphery of the ovaries, leading to increase in ovarian size. And these cysts appears. What are these cysts? So what happens is each cycle one egg starts moving from the center of the ovary. It reaches the periphery of the ovary and doesn't burst and stays there. And that's how multiple times many eggs will come and collect at the periphery of the eggs, and you feel that the ovary is enlarged and these tiny cysts are collected, and all these cysts are below 10 millimeter, below 1 centimeter. They are never below above 1 centimeter. They are typically 6, 8, 9 millimeters. So please do not confuse once again polycystic ovaries with ovarian cyst, and polycystic ovaries do not need any surgical treatment. Once upon a time, a lot of surgical treatment was advocated, but it is obsolete now. The best treatment for polycystic ovaries is weight loss, and there's nothing superior to that. And beyond that, we talked again insulin sensitizers. Finally, if the insulin sensitizers, insulin and induction of ovulation agents do not work, that means egg formation also doesn't work, and all parameters. In spite of that, the ovulation is not occurring, in spite of very large doses of injections. Then, very rarely, a laparoscopy is considered to puncture these small, tiny cysts. But laparoscopy remains very short lived. The effect may last only up to 1.5 year and not beyond. So, and this can create some adhesions. So, laparoscopy is not the first choice and done very uncommonly these days. But laparoscopy is done more to ascertain the status of the tube and to see if there are other causes associated with fertility. So, weight control will optimize the body shape, body structure. It will prepare the body for better conception. The ovulation will be better. The pregnancy will be less complicated, and things will all go fine. So, once again, to summarize, weight loss, diet, exercise, insulin sensitizers, induction of ovulation through tablets and through injections, and finally, if nothing works, then finally IVF. So there's a question here. I'm 32 years old. What are my chances to have baby with PCOS, and what do I need to know? So this is very interesting. PCO women generally have excess of hormones in their body, and they remain healthy for a longer time. That means they remain fertile for a longer time. So 32 is not a problem as far as your hormones are good. If you have plenty of eggs remaining behind in the ovary, which is tested by various hormonal tests, then and by doing an ultrasound also, so then you can be assured that you will have a baby. There is a very small chance that something can go wrong. So what you need to know is that you should lose weight if you are overweight. You should ovulate regularly. You should test that you're ovulating. And once you ovulate, you try regularly. The problem these days is because of the stress, the rates of copulation is very low. That means people are not having sexual intercourse even while they're trying to conceive. And when we take history, it's as low as about once a week, or probably even less, once in 15 days. So when you're trying to conceive, this low frequency doesn't work. So you must have frequency of intercourse more often to conceive. Is it feasible to continue fertility treatment with PCOS during COVID for my wife? Well, it all depends on your desire, because COVID is going to stay here for a very long time. There's a lot of debate about it, but there have been estimates till 2023. So, are you willing to wait till 23? And what's the age of your wife? If your wife is 20 years old and polycystic, there's a good chance that she'll be able to reproduce till a little later age, and she has enough time in her hand. But if you and then polycystic ovaries also, you need to know what is the range like, what's the fertility level. But if your wife is old, if she's already 30 plus, then you might wait a couple of months, say 3 4 months, till the COVID settles. But that is only if the hormones they permit. If your hormones are borderline and they do not permit, that there's no recommendation to wait for fertility management because of the COVID. So the guidelines are changing every day, but the recent guidelines suggest that if you need treatment for fertility, COVID is not a hindrance. Is there any effective diet which I can follow to get pregnant and have healthy pregnancy despite polycystic? So you should, every meal, you should have small amounts of carbohydrates, small amounts of fat, small amounts of, and good amounts of protein. So if you're a vegetarian, which your name suggests, then probably for breakfast you can have a bowl of, say, upma with, so this will become your carb. Then now you need a protein, so you can have a small cup of milk and then probably half a fruit. So that should suffice. So that gives you, and then in the lunch, you can have salad, then dal, and probably one chapati. So likewise, if you eat 3 4 hours, you should be able to lose weight. So eat complex carbohydrates and small frequent meals. Is it possible for polycystic ovaries to resolve itself naturally after having a baby, or is PCO lifelong? Okay, so PCO is like body fat. It is less and more. It is never zero. Similarly, in those who have polycystic, whenever the weight loss occurs, polycystic, they do not appear. The cysts disappear from the ovaries, and whenever the weight gain is more, the cysts will appear. So we can't say that weight loss will lead to healing of the polycystic. So it is, when if there is weight loss, the polycystics are suppressed and there are no symptoms which appear. But polycystic is genetic, it is inherent, it is within the body, it comes with us and it goes with us. So we can't say that it will go out completely from the body. Yes, if the body weight is maintained, it will never trouble. In general, knowing I have polycystic ovaries, what kind of things besides taking medications can I do to help increase my chances of conception while going through fertility treatment. Now, the biggest challenge is the stress. This is the biggest challenge. What happens is doctors can improve everything. They by giving you medications, they can actually make your system work better. If you're not ovulating, you start ovulating. You are also working hard towards losing weight, making your body correct. You control your hypertension, diabetes if you have. You take medicines, and whenever these polycystic women are given medications, they take it absolutely regularly. We have no complaints. They take it, but the problem is the mind and the pressure from the surroundings, from yourself, from within, and from the people outside, the mother-in-law, the neighbors, the friends, everybody. Then people start comparing. She got married later, she's got a baby. So, as if there's a competition going on, who gets first, who's the first one to get it. So, it's not the case. So, what I believe is do things at your own pace, relax completely, know about the urgency from your doctor, and I'm certain that you'll conceive. But your body must relax to conceive. My wife is having PCO. Is there any cure, a way to fix PCO? So, weight loss is the only way to fix PCOS forever. And as soon as the weight comes back, the PCOS comes back. If she's not planning a baby, she can be put on contraceptive pills if there are no other contraindications. So, a proper evaluation is done before pills are prescribed. If she's planning a baby, then there are other medications that we talked about. But once again, weight loss, there's no substitute to weight loss. Do my wife need to lose weight if she's overweight or obese in order to do fertility treatments in case of PCOS? This is every doctor's dream, that if patient is able to lose weight, the treatment becomes easier and more successful. So even 5 kgs body weight helps tremendously. So if anybody who's obese should lose weight, and should, or at least should try hard to lose weight, because in polycystic, weight gain is very fast and weight gain is very slow. So please do not allow any weight to come. Since polycystic affects hormonal levels, will I have to use more medication than a typical fertility patient? Uh, Before conception, yes, till the time you conceive, there's a possibility that you will need to take, other than folic acid, insulin sensitizers, or uh, induction of ovulation in terms of egg formation medications. So there's a possibility. But if you're making an egg on your own and conceiving on your own, then there will not be any additional need. So, not all polycystic ovaries would need added medications, but those who do not ovulate would certainly need an added treatment. Thank you so much. So nice speaking to you. We hope to hear from you. If you would like to know on any certain topic, do write to us. Thank you so much. Have a great day.